Hi, I'm Dr. Lisa McMahon, and I'm the co-director of the Phoenix Children's Chest Wall Program. I'm here to talk to you today about slipping rib syndrome. So what is slipping rib syndrome? Well, it's a condition in which the lower costal cartilages, or ribs, don't connect to each other, allowing those ribs to slide against each other and impinge upon that intercostal nerve that runs on the back side of each of our ribs. This is a diagram showing that shows the rib here, the bony rib here, and the cartilage here. They aren't connected to each other. Usually it's 8 to 10. They generally connect to each other and then connect to 7, which goes to the sternum. But when they don't connect, sometimes they can be malformed and they're more likely to encroach upon each other like this. This can cause symptoms of pain mainly. So sometimes people will hear a clicking sound or a sliding sound or a weird feeling inside of their body of something kind of snapping. And then that's oftentimes associated with pain, either immediately or a little bit later. Oftentimes the pain is sharp and stabbing and just directly in the area where the ribs slide against each other, and other times it's a kind of more dull, achy pain. And the pain can travel towards the back too, but generally it's mainly localized in the front. This can sometimes be a difficult diagnosis to make. The key is to know that it exists to be able to look for it. But one of the easy ways to find out if you have it or not is just to feel along your lower costal cartilage. And if you feel things move, and especially if it's associated with pain, then likely these cartilages aren't attached. Now, just because the cartilages aren't attached doesn't necessarily mean you have a slipping rib syndrome. It just means you have a slipping rib. Only if there's pain do we really call it the syndrome. At this hospital, we've also developed a protocol to look and diagnose this with ultrasound. And so the ultrasound uses radio waves to see these ribs, and then they do some maneuvers. So you do a sit-up or push on the lower costal cartilage, and you can see these move against each other, thus diagnosing the condition. To treat slipping rib syndrome, the first thing we want to do is conservative management. So rest, stopping the activity that causes the pain, using ice sometimes if you have pain, as well as NSAIDs like ibuprofen, can really decrease the inflammation and make it feel better. However, for some people it's quite debilitating pain and they're not able to do their regular activities or the things that they love to do. And in that case, the option is surgery. The traditional operation is to remove these costal cartilages because then it removes the mechanical reason for you to have the pain. If there's no more cartilage to impinge upon the nerve above, then ideally the pain would go away. Now, sometimes these ribs, the bony ribs themselves, are quite flexible as well. And traditionally, these have been partially excised in some cases also. However, this does seem to add some protection to your abdominal wall and your chest, and therefore it's not something that I like to remove. These cartilages aren't actually helping too much in terms of your structure if they're not connected to each other and they're moving around. So I developed a technique in which I place a vertical plate along these ribs should they try to move against each other in the operating room. And that's really decreased the rate of recurrence for this, or the rate of recurring slipping ribs for this procedure significantly. Usually it's an overnight stay in the hospital at our institution, and people tend to recover fairly well, especially after physical therapy. Please give us a call if you have any questions about slipping rib syndrome. We would be very happy to answer any of your questions or see you in consultation. Thank you.